Namaste. Uh, Good evening. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. So, in my pursuit of addressing, promoting, and propagating Ayurveda and psychotherapy globally, every week I come up with different topics on Ayurvedic psychotherapy, mental health, and psychotherapy, modern psychotherapy. So, but this today's topic of discussion is a bit different from usual. Today I'm going to discuss today's session is dedicated to breastfeeding awareness and importance of breastfeeding. And this one week, that is breastfeeding is age old. It is it is not new, but the breastfeeding awareness by the WHO, the World Health Organization, and UNICEF 2023. And see, the theme for World Breastfeeding Week to 2023 is like, let's make breastfeeding and work both work. So let's enable breastfeeding and make it easier for women at work, to breastfeed. So, what is the, if you ask me, what is the purpose of World Breastfeeding Week? Every year, World Breastfeeding Week is celebrated in the first week of August. So, August 1st to August 7th. Today is August 8th, but I thought it is never too late to discuss about breastfeeding, its importance, and to spread breastfeeding, awareness. And see, it is observed globally to raise awareness about the importance of breastfeeding and its benefit to both mother and the infant. So its main aim is to support. Why is this World Breastfeeding Week really important? Is its purpose and aim is to support and encourage breastfeeding as a vital aspect of the health and well-being for both the mother and child. So, breastfeeding is important for the infant and equally important for the mother as well. So, today I'm gonna discuss on how what Ayurveda has to say about breast milk and breastfeeding, Ayurvedic insights on breastfeeding, and what does Ayurveda Acharya say about have to say about breastfeeding, and general benefits of breastfeeding to it is how does it benefit the holistic wellness in the mother, and of course its benefits to infants. So, breastfeeding is largely acknowledged as the healthiest form of nutrition for the infants. We all know this. So, hence, it is important that we feed the only food for their hungry little tummies is the right way possible. So, for nearly all infants in their first year of life, the breast milk is the best meal. So, both the mother and the infant benefit from the best milk. So let's dive deep. Let's get the deep insight of what does breast milk contain. So breast milk is a complex and highly nutritious fluid that provides essential nutrients for a baby's growth and development. So it is highly nutritious and it is very complex. So its composition can vary based on factors like mother's diet and baby's age, but generally breast milk contains majorly water, the primary component ensuring hydration in the infant. It contains carbohydrates, it contains fats, it contains proteins, it contains vitamins, it contains minerals like calcium, iron, zinc, and other minerals which are vital for bone and overall development. It contains Breast milk also contain enzymes which aid in digestion and nutrient absorption. So hormones. It also has hormones which help with growth and development in the child, because child has to double its weight by within 6 months. You can just imagine that to double the weight of a newborn within 6 months, how much essential it is to have all the nutrients in the breast milk. So, breast milk also contains antibodies and immune factors which contributes to the baby's immune system and development. And it also has white blood cells. White blood cells help to fight infection. It is, scientifically proved that infants consuming breast milk are, less prone to infections rather than, infants not consuming breast milk, who should opt for, other nutritional sources, milk sources, right? And see, and if you ask me, theoretically, breastfeeding can be continued up to 2 years and beyond. It is decided as per the doctor and the mother of the infant. But by the World Health Organization and UNICEF, United Nations International Child Emergency Fund, UNICEF, or it is also shortly called as United Nations Child Fund. So, the first 6 months should consist exclusive, breastfeeding, and after that, breastfeeding should be continued alongside appropriately with the complementary foods at least up to 2 years, or as long as mutually desired by the mother and the baby. So, this is it. So, when it comes to breast milk, the first 1 or 1 to 3 days, the milk which is, the milk is which is secreted, the breast milk is called colostrum. So often it is referred to as liquid gold. Why? It is the first milk produced by the mammary glands of the lactating mammal. It may be a human being or a mammal. In the initial days after giving birth, it is unique and essential substance that plays a crucial role in nourishing and protecting newborns. So, what does colostrum have? Colostrum is different from mature breast milk in terms of its composition. Colostrum is usually thicker and more concentrated. It is more yellowish in color, so containing a higher amount of certain nutrients and bioactive compounds. Colostrum is rich in proteins, immunoglobulins, that is antibodies, growth factors, vitamins, minerals, and enzymes. So these components contribute to its remarkable health benefits for the newborn. So now let's see what are the benefits that's, general benefits that, infants get from the breast milk. So the main thing is nutrition. Breast milk is a complete source of nutrition for infants, containing all the essential nutrients needed for growth and development. So including proteins, fats, carbohydrates, vitamins, and minerals, and it supports the immune system. Breast milk contains antibodies and immune cells that help protect infants from infections, allergies, and illnesses. It reduces the risk of conditions like respiratory infections, ear infections, and gastrointestinal infections in infants. So it almost reduces the risk of everything like respiratory infections, gastrointestinal infections, ENT infections, especially ear infections, which are commonly seen in infants. And digestibility, breast milk is easily digestible and gentle on babies developing a digestive system. We should note here that infants don't have the developed digestive system or developed renal system. It is still developing. So breast milk is easy for digestion. So, and it also reduces the risk of constipation and other gastrointestinal issues. And breast milk contains important fatty acids like DHA that are critical for brain development. Breast milk, promotes brain development in infants. So it contains important fatty acids like DHA that are critical for brain development and cognitive function. It has been linked to improve IQ scores and better neurodevelopment. There are some studies which indicate that drinking breast milk, the breast milk fed infants have more improved IQ and better neurodevelopment than the infants who do not drink breast milk. So, breast milk also reduces the risk of chronic diseases. Breastfed babies have a lower risk of developing chronic health conditions such as obesity, diabetes, asthma, and certain allergies later in life. So it reduces the risk of chronic diseases. And the bonding, the main thing is breastfeeding promotes physical closeness and bonding between a mother and an infant and mother and a baby. So it provides comfort and emotional security. So it is also good for the mental well-being of the child and the emotional well-being of the child. So these are the benefits the child or the infant gets from breast milk. What are the benefits to the mother? Does mother have any benefits from breastfeeding? Yes, of course. What happens is breastfeeding triggers uterine contractions, aiding in the recovery of the mother's uterus after childbirth and reducing postpartum bleeding. See, breastfeeding can also reduce the postpartum bleeding. What happens is breastfeeding triggers uterine contraction, so it helps in recovering of the mother's uterus after the childbirth. After the childbirth, mother's uterus is affected, so it helps in the recovery and reducing postpartum bleeding. And weight loss, see, breastfeeding helps mothers shed pregnancy weight more quickly by burning extra calories. So you are pumping breast milk regularly, so you're producing breast milk and you're feeding, so your calories are getting reduced. So it is easy for the breastfeeding mothers to shed pregnancy weight. And it also helps in utilizing the stored fat reserves. And there are there are studies to prove that there is a reduced risk of certain cancers. Breastfeeding has been associated with a decreased risk of breast and ovary cancers in mothers. So breastfeeding reduces the risk of breast and ovarian cancers in mothers. So there are some studies backing the evidence that this can prevent breast and ovarian cancers in mothers. So delayed ovulation, what happens is exclusive when you are exclusively breastfeeding, exclusive breastfeeding can delay the return of the menstruation and ovulation. So acting as a it what it does, it acts as a natural form of birth control for a certain period of time. So when you are exclusively breastfeeding, it acts as a natural form of birth control, because the exclusive breastfeeding delays the ovulation and the menstruation. So next is emotional well-being. So breastfeeding, what it does, it triggers the hormones like oxytocin. So what oxytocin does is it promotes the feelings of relaxation, it reduces stress, and it increases maternal attachment, that is bond. So breastfeeding is, is a tool for, emotional well-being of the mother. So it triggers the release of hormones, as I said, oxytocin, that is oxytocin. This oxytocin gives the, promotes, relaxation, stress reduction, anxiety reduction, and it improves the bond between the mother and the child. And convenience, see, breastfeeding eliminates the need for preparing formula, sterilizing bottles, carrying equipment, and making it a convenient and cost effective feeding option. See, it is also a cost effective and convenient feeding option, rather than, you have to sterilize the bottles, you have to prepare the formula, you have to carry the equipment, everything. So it is better. So it's important that, see, breastfeeding offers numerous benefits, each for, each mother and infant pair is, unique. So it also may happen that individual circumstances may influence the choice of feeding method. Consulting with the healthcare professional, see, if you want a guidance, you can consult a healthcare physician before planning on your, before planning on your breastfeeding journey. So here, now let's talk about Ayurveda. What Ayurveda has to say about breast milk and, you know breastfeeding. So Ayurveda, as we all know, is the timeless wisdom. It is the well documented, well evident science. So we see the profound, there is a profound significance of breastfeeding encapsulated in, Ayurveda. It is, see, Ayurveda says that, um, has a breastfeeding has multifaceted benefits for both child and mother. See, this was told 5,000 years back itself. See, what it does is, what Ayurveda says, it is avyahata balangayur rajo vardate. See, it says that breastfeeding fosters strength, longevity, and growth. Bala, bala, ayu, all these things, growth. And see, it fosters strength, longevity, growth, and overall well-being for both mother and the child. So how does Ayurveda assess breast milk quality? So Ayurveda offers a simple, tool, yet powerful tool, to assess breast milk quality and quantity through the method of, see, there is a quick home test you can do. A quick at home test involves mixing of, see, dropping of small amount of milk in water. In the breast milk, you just drops few drops in the water, few drops of breast milk in the water, where if there is a homogeneous mixture of, that is, if the breast milk combines with water, if it combines with water, it becomes a homogeneous mixture, then it signifies that the breast milk is pure and it is vitiation free. If it separates from the water, or if it does not mix well, if it is easily mixed, then you can think that breast milk is pure. If it does not easily mix, or it gets separates from the water, then there is some issue from in the breast milk, that is some vitiation, some dosha imbalance in the breast milk, which can be corrected. So this is what Ayurveda has to say about the breast milk quality. So it is called Stanya Sampat. See, the pure breast milk. What is pure breast milk according to Acharya Charaka? See, Acharya Charaka is of the opinion that that is normal in color, fragrance, taste, and touch, and that which mixes uniformly when poured into the water, blesses the kid with sustenance, that is pushtikara. It is strength, and it is for strength and sustenance, arogyam, good health. And he describes stanya, breast milk is called stanya in Ayurveda. Of such qualities is, all these qualities is best for the child. So, and breastfeeding and its advantages, according to Acharya Kashyapa is a pediatrician, Ayurvedic pediatrician. He has worked on kaumara bhrutya, we call, on pediatrics and children. So exclusive breastfeeding, according to Acharya Kashyapa, results in a child's growth, strength, longevity, and good health, as well as the absence of diseases, that is, infectious diseases mostly. So, breastfeeding is largely acknowledged as the healthiest form of nutrition for human newborns. So, breastfeeding should begin as soon as feasible after birth, as it has also numerous advantages. Acharya Kashyapa says that the breastfeeding should begin as soon as possible after the birth. It is good for the baby as well as the mother. So, breast milk contains all the nutrients that a newborn requires for optimal growth and development throughout the first 6 months of the life, including carbs, lipids, proteins, vitamins, and minerals, and water, as I said. See, Ayurveda advocates the advantages of stanya, that is breast milk, over feeding other options to newborns. Ayurveda considers mother's milk as piyusha. Piyusha is amruta, that is nectar. It acts like amruta for the infants. So Kashyapa Samhita states that pure breast milk gives unimpeded strength, longevity, growth, development to the child and also the mother. So, Kashyapa Samhita discusses breastfeeding and infant feeding as an internal part of maternal and child care. While the and it also emphasizes on personalized recommendation, because every mother is different and every human is different. So there are customized approaches as well for the vitiation of breast milk, or it is unique for every mother and infant pair. So, in Ayurveda, breast milk is also called Swadukshiram. That means, sweet milk. It is sweet in nature. So, the breast milk is considered the ideal and complete food for an infant. So, see, the breast milk is considered to have, according to Ayurveda, it is considered to have Madhura Rasa. Madhura Rasa is sweet in taste and a cooling potency. Its potency is cool. So, Shita Virya, we call it Shita Virya in Ayurveda. And this is, believed to provide nourishment and keeps the child calm, and maintains the baby's body balance. So, and what it does, it, as I already have mentioned, according to the modern as well, it is good for the digestion and the digestive fire of the infant. Breast milk is considered easily digestible, that which we call it laghu in Ayurveda. Laghu is easily digestible and supports the development of the baby's digestive fire. So what it does is this helps in proper digestion and assimilation of nutrients. Next, dosha balance. Breast milk is believed to help balance the three doshas. We have Ayurveda is mostly based on three dosha theory, that is Vata, Pitta, and Kapha. So, breast milk is believed to help balance the three doshas, that is Vata, Pitta, and Kapha in the baby's body. So, the nutritional and energetic qualities of breast milk contribute to maintaining overall doshic equilibrium in the child. So, and then ojas and immunity. Immunity is called as ojas in Ayurveda. Breast milk is considered to enhance the baby's ojas, which is essential for all the baby with bodily tissues and responsible for vitality, immunity, and overall health. So, breast milk is believed to contribute to the formation of strong ojas, that is, immunity for the development of stronger immunity in children. So, and it is also said that, yeah, as it is in the modern medicine also, it helps in emotional bonding and mental development. Breastfeeding is not only about the physical nourishment, but also the emotional bonding between the mother and the baby. So, Ayurveda recognizes the importance of this emotional connection in the baby's mental and emotional development. So, maternal diet and quality of breast milk. See, Ayurveda says that, and Ayurveda also emphasizes that the mother's diet and lifestyle during breastfeeding is really important, because a balanced and nourishing diet, along with practices to maintain her own doshic balance, is believed to positively impact the quality of breast milk. Whatever mother consumes as food and the lifestyle, it also affects the baby, it also enters the milk, so it also affects the baby. So mother's diet, maternal diet, is directly proportional to the quality of the breast milk, is directly related or linked to the quality of breast milk. So breast milk's adaptability. So, Ayurveda acknowledges that breast milk adjusts its composition according to the baby's needs. It adapts to the changing doshic influences and developmental stages of the baby, providing personalized nourishments. So, and feeding guidelines. Next, all these and see, these are the benefits to the child as per Ayurveda. And what are the benefits? I stated more modern medicine, a few benefits in general discussed in modern medicine. What Ayurveda has to say about the benefits of breastfeeding to mothers? See, physical recovery. Breastfeeding is believed to support the mother's postpartum recovery by promoting uterine contractions and aiding in the restoration of the body's natural balance. See, enhancement. Ojas is immunity. Just as breastfeeding contributes to the formation of immunity in the baby, so it also enhances ojas in the mother, that is immunity in the mother, promoting vitality and overall well-being. Emotional bonding, this is the most important thing. The breastfeeding fosters a deep emotional bond between the mother and the baby, promoting feelings of love, security, and connection. What happens is this also reduces postpartum depression in women. So it is helpful for, I will discuss in the session itself, it is helpful for the mental well-being and holistic health of the mother as well. So breastfeeding, because it decreases the risk of postpartum depression as well. So hormonal balance. Breastfeeding stimulates the release of hormones, that is oxytocin, that helps reduce the stress and promote relaxation. It also aids in preventing postpartum depression, as I said. See, and it acts as not natural, contraception. Exclusive breastfeeding, it is also it is also known as lactational amenorrhea method, LAM. That is, it is a natural form of contraception, delaying the return of menstruation. If you're exclusively breastfeeding, there are chances that your menstruation or the ovulation is delayed. Okay, these are some of the benefits to mothers. So let's discuss. So, as I am a mental health professional, I am an Ayurvedic psychotherapist. I can't, end the session without discussing the role and benefits of breastfeeding to the mothers in mental health and postpartum depression. What it also has, breastfeeding also plays a significant role in supporting a mother's mental health and helping to prevent or manage postpartum depression. So, how does it manage oxytocin release? As I said, breastfeeding triggers the release of oxytocin, often referred to as the bonding hormone or the love hormone. The oxytocin promotes the feelings of relaxation, emotional connection, and holistic well-being and emotional well-being. So this hormonal response can help alleviate stress, anxiety, and depression, contributing to improved mental health in women who breastfeed, mothers who breastfeed. So next is emotional bonding. See, the physical closeness and nurturing also, facilitates a strong emotional bond that also, provides a sense of purpose, fulfillment, and joy, and helps in emotional wellness of a mother. So, reduced postpartum depression risk. See, all because of this, there is a reduced risk of postpartum depression. This is breastfeeding is associated with a reduced risk of postpartum depression. The oxytocin released during breastfeeding can help regulate mood, reduce stress, and support emotional resilience, potentially lowering the likelihood of postpartum depression. It can address a postpartum depression to a certain extent. So, and distraction and focus, the act of breastfeeding can provide, a mindful and soothing experience for the mother, redirecting her focus from stressors and worries. From stress and worries, her focus is on, breastfeeding, and the soothing experience, and a sense of joy and attachment due to the breastfeeding. So this mindfulness can contribute to the improved mental clarity, and it helps in emotional regulation and emotional balance. So, see, and as I said, it helps in physical recovery and, weight loss after childbirth, and it also, gives a sense of spiritual and energetic connection. Breastfeeding can create a profound spiritual and energetic connection between the mother and the baby. So, this nurturing act can promote a sense of purpose, gratitude, and interconnectedness. So it reduces postpartum depression like this. So it promotes body and mind harmony, that is mind body harmony. Holistic health emphasizes the integration of mind, body, and spirit. So breastfeeding involves physical, emotional, and spiritual aspects. The spiritual, you can take it as psychological aspects, promoting a holistic sense of well-being. So it also promotes natural rhythms. That is, breastfeeding encourages mothers to align with the natural rhythms of their body and their babies. This connection to natural cycle contributes a sense of balance and harmony. मतलब regular feeding, and sleeping with the child. When the child naps, the mother also can take a nap. There are natural rhythms. The natural rhythms are maintained, because of breastfeeding. So these are all the mental health benefits, and for the mother who breastfeeds. So I just want to end this session by saying, let's enable breastfeeding, and let's create awareness of breastfeeding, so that breastfeeding becomes normal even in public. So thank you for staying tuned, and namaste for today.